No, I don't see him, Dr. Manoj. I'm sure he'll join soon.
Okay.
So DTOs, last time we had Dr. Sandeep Mishra, talking with us while the presentations were going on. So we got very positive feedback from all the DTOs. So today also, the main objective is the PDSA presentation. But along with that, we will have the discussions going. And I request all the DTOs to participate in this discussion. If a point comes to your mind, please do share. This platform is for sharing of knowledge and information. Nobody is teaching anybody. We don't claim that we can teach anything to anybody. Yes, we can share information. We can share knowledge. There is something that we know better. There are many things that you are expert at. So if there is a discussion going on, please either raise your hand or unmute yourself and participate in the discussion. So that will be my request. And we have a lot of PDSA presentations lined up, Dr. Manoj, today, one after the another. And it is so good for me personally, when I announce one presentation from East and then move to the North and then suddenly come to the South, it brings such a wonderful flavor of the country in this small gathering. Dr. Kaushik Das, how is the rain in Assam now? Is it better, a bit less, or you're still suffering?
So this is a good way to get the pulse of the country all at one shot.
Yes, that's the beauty.
Yeah, that is amazing. And to see that there's a common experience of rainfall. I'll say this, in the United States, that doesn't happen quite often, right? We don't go through these seasons of monsoon like that happens in India. Rains can come at any time, which when I still recall when I shared that with folks in India when I was coming back at my younger age, and they said, how can that be? How can you get rain in the middle of the summer? How can you get like lots of rain in the middle of the winter? I said, it just happens. It just comes. And very, very funny way of how the weathers are. And now it's all changing quite rapidly. We've had landslides and just torrential rains and fires. I don't know if you know about the sequoias, the oldest trees in the world and the tallest, and they were a threat of being burned down. 1,000+ years old. Just imagine, 1,000, 2,000 years old at the time of Mahavira and Jesus and Buddha and others saints. That's when they were initiated, and they're still growing and alive, and the forest fires really threatened them.
Yeah,
so amazing things across the world. So
great. So Dr. Das from Assam has responded. He's saying it has become too hot now. Just about 20 days ago, there were floods there. It was terrible. The rains were 5 times the rain that they were supposed to receive. They received in 1 week. So with this, Dr. Manoj, good morning to you, and I welcome all the DTOs from all across the country to the session today. And before I formally start, I wish to inform you that our journey is slowly coming to an end, and on 29th of July, we will close this course. We will have the closing session. It will be great. If you look at your screen, the closing session will also be represented by the CTD, the CETI team, The Emory University Global Health Institution staff will be there, the people from the top echelon. We will have World Health Organization represented, and we'll have also representation from Indian Institute of Public Health, Gandhinagar, besides many other eminent personalities from the TB world, from the public health domain, who will be present on the 29th of July to see the completion of your course. We will also be extending a very, very special invite to all the state tuberculosis officers. And it is our good intention that, if the STOs are present, the felicitation ceremony, we will be distributing your certificates, which will have the logos of all these things which are right now in front of your screen, that your STOs give the certificates to the DTOs. It'll be wonderful to see that happening. So the counselors will be really, really behind you. And this message is to the counselors also. Please keep the good work going. Make sure that you stay connected in the next 15 days, complete the PDSAs, get the data, and make sure that your DTOs qualify for the certificate. Is my voice audio being heard?
Yes. Yes,
okay.
Yes, very much so. And I would second that, Commodore Raman. We do not want to lose steam at this last stage of our PDSAs. We know that the last mile is always difficult. In fact, you know that better than anyone else. You are the last mile for the TB journey for the nation. And so for this PDSA also, we are in the last stretches as you begin to complete, get the data, and then to have a experience of seeing your numbers boost up. So
absolutely. And I want to also tell you, Dr. Jain, that in the last 7 days, the amount of engagements with the DTOs that has happened is phenomenal. And DTOs, if you feel that your data had not started, or you feel you have delayed it, or you have missed the bus, nothing like that. Okay, in Hindi there is a saying, "Jab aankh khule, tab savera samjhe." So you may start from today also. 15 days is more than enough for you to realize what this process can do to you. So please do participate and experience it for yourself. So give the last push. And the reason why we are presenting so many PDSAs right now is DTOs, and I'll be very frank to share it with you, so that there is no hesitation. All those amongst you, there is a hesitation to accept something new. You are seeing your peers give the PDSA presentation. You have a look at their PDSA. It is very simple. So if there is any apprehension, that can be addressed. It's a very, very simple approach. And also, last, your STOs would get another mail. They have got another mail from the Central TB Division, that especially from the southern states, that we will be doing a bigger form of the exercise, which will last for 6 months with the DTOs of the southern states. So you must have, your STOs have got the input. The team leads and the counselors will brief you more on that. And with this, Dr. Manoj, I think we will start with the day's thing, and I'm sure Dr. Sandeep will join in the meantime.
Absolutely.
So Abhishek, what have you got for us? I think last time we had stopped with Dr. Bindu Bahel being ready. And Dr. Bindu Bahel, DTOs, is an old associate with us. She has been with the course before also. She is the DTO of Shahadra, Delhi. She is a wonderful poet. And I must tell you that she, in her poetry, has covered the entire syllabus that we do with the DTOs. So in some other opportunity, I will request Dr. Bindu Bahel to give her poetry also. But for today, may I request team lead Shubhangi to kindly share the screen. And Dr. Bindu, please present your PDSA.
Thank you, sir. Good evening, everyone. Good evening, Commodore Raman sir, Dr. Manoj sir, and our entire CETI team. Thank you very much for giving us this opportunity to learn new tools and techniques to deal with our day-to-day work. Well, I am DTO of Shadra, which is located in thickly populated area of East Delhi, mainly suburban and slum area. The problem which we analyzed, which was hindering our notification, is at the level of reaching, that means reporting to the chest clinic. The problem is of low TB notification due to less referrals from the RMPs. Lot of patients, they were going to the unregistered practitioners, and there was lack of awareness in the slum and local chemists for not notifying the TB patients. So this, keeping all this in mind, my aim statement which I constituted is in Shadra, Delhi, we will increase total notification by 10% within or by 31st July by linking ASHA workers, CDPs, and TB champions, private practitioners, RMPs, and the local chemists. The process measures selected were the training sessions of the ASHA workers, CDPs, TB champions, the various IEC activity, the ACF activities right at the location, the number of referrals. Outcome measure will be the number of total notification which we want to boost up. In my team, apart from me, there is MOTC, my STS, and my dot plus supervisor, Mrs. Manisha. Coming to the process map, we can see that this is the normal routine that patient visits the OPD with the symptoms. Either they are coming directly to the OPD or they are coming via the private practitioners. They may be going to the non-allopathic practitioner, then coming to us. Some patients, they must have attended IEC activities which were conducted by the TB champions, or they are referred by the pharmacist of the nearby area. ASHA workers, they also have a very important role because they go house to house, they also refer the patients to us. Various IEC activity are conducted by our staff and TP staff also. And by all these things, patients are coming to the OPD, and this is our gray area, which we have taken care of. After this, the patients undergoes the physical examination, the various, can we come back to the process map, Dr. Shubhangi? Yeah. After this, sputum samples are collected, then smear is examined for the microscopy, and NAT, chest X-ray is done. And ultimately, when the patient is found TB positive, is put on the ATT. And we can see the various process measures. As I told you earlier, the training sessions were conducted for ASHA workers, CDPs, TB champions, and IEC activity were conducted by us, ACF activities, and the referral patients were also taken care of. Next, please. Yeah, we see that in this bar diagram, we can see the various activities which were conducted by us. The first is the ASHA worker training, which were conducted once in every week in last month in the June. Then we can see the IEC activities which were conducted at the field level by the TB champions. They were also once in a week. ACF activity we doubled because this is our main intervention. We did this on every Tuesday and Thursday. The sessions organized for awareness of chemists were about one in 15 days, and same about the private practitioners. If we see the graph of monthly notification in public, private, and total notification, we can see the dip at various levels from starting from January 19 to June 22. We can see these dips, and again we are coming back in May. Again we saw a big dip, and this was the main reason that why we selected this boosting up activity of notification. If we see the outcome measure, can you show this graph of outcome measure? Again, we can see a dip in the May, and this was the reason why we selected. Next, please. Next, please. Yeah, this is the summary. So we plan to increase the total notification, me and my MOTC. On every alternate day, we did the notification at Shadra, and patients, the referred patients, which were because of our interventions. Our do part, we started the activity on 11th of June at Shadra by me. The baseline notification was 468. So this was to be 10% more than that. That means target is 515. And we're still waiting for our results. Our act is adapt because we are still undergoing this process, and we will be utilizing all the interventions which we are doing for last 1 month. Can you show the action photographs also? There are some action photos of me and my team in full charge with TB champions, ASHA workers, and TB staff to make them aware about the significance of TB notification. Now we have put our efforts, and now we are keeping our fingers crossed to see the results on 31st July. Thank you.
So excellent, Dr. Bindu. Really good work. So when you looked at the May data, and I want to
sir.
ask you this, and you noticed that there was a dip, and
Yes, sir.
what was some of the root cause conversations that happened in looking at the dip?
So main cause which I found is private practitioners, because earlier there's an NGO G, they were bringing the data of notification from the private practitioner to us, and suddenly this G is gone out of the project, and this is one of the reasons. Second reason can be, sir, there can be some seasonal variation, as we see earlier also in a particular season the number of TB cases they show a dip and they again come up. So that's why we have taken this boosting process at this time, sir.
Excellent. And I can see that in your red. So if you point to the red line, you
Yes,
can
sir.
see that was a steep.
Yes,
steep
sir. Slight increase. Yeah.
Yeah. And then, but so.
But we are hopeful, sir.
Yes, absolutely. And you were able to see the reason for the dip and stuff. Let me ask you this.
Yes, sir.
Did you look at your presumptive TB examination?
Yes, sir.
Number. How was that number over this process?
Sir, presumptive number is also increasing because main is the presumptive number which comes by these interventions. So it has drastically increased, sir.
Okay. And did it also take a dip in that May time period?
Oh, yes, sir. Yes, sir. There was a big dip of that. That's what we can see in this. Yeah.
Okay. So one of the things that we learn is that if we can, you looked at your notification and said, oh my gosh, something has happened.
Yes,
and
sir.
then you went back and you had some reasons. And then you also had a measure, the presumptive examination as a measure to say that we had declined on that one as well. So very good work. I think the take-home message for me and for everyone is the following. Look, numbers will go up and numbers will go down. However, what is critical is knowing the reasons behind what is happening and then to take action. As you saw Dr. Bindu taking action based on, wait a second, things aren't there. The outcome measure is not where we want it to be. And so looking at the root causes and then taking action. So that is the benefit of the PDSA in real time. It's not like we waited for 2 months or 6 months or something. You are doing this on real time. So congratulations and great work.
Thank you, sir.
Thank you, Dr. Bindu. Thank you, Dr. Manoj. So, Dr. Bindu, your focus is very clear where it is lacking and where you need to put your entire energy. Great. Now it is time for me to invite Dr. UK Nath. He is DTO Lohit, Arunachal Pradesh. So straight from Delhi to Arunachal Pradesh. Shubhangi, may I request you to start sharing your screen, and welcome, Dr. Nath. Dr. Nath, please unmute yourself. Yeah, we can hear you. Very nice.
Hello, am I audible?
Yes. Please go ahead.
Good afternoon, good evening, everybody. Thank you very much. I am Dr. UK Nath, District TB Officer of Lohit and Anjao District of Arunachal Pradesh. I am from Arunachal. These districts are situated in the easternmost part of Arunachal Pradesh with an area of 8,592 square kilometer, covering population of 97,498. तो हमने BTN के लिए 8 जून से हमारा एक्टिविटी शुरू किया है। हमने चुना है कि विलेज मुखिया, सब सेंटर्स, फार्मेसिस्ट को सेंसिटाइज करेंगे टू इंक्रीज पब्लिक नोटिफिकेशन। हमारे यहाँ पब्लिक नोटिफिकेशन ने, प्राइवेट नोटिफिकेशन ने, प्राइवेट सेक्टर है ही नहीं यहाँ पे ओनली पब्लिक सेक्टर है। तो हम विलेज मुखिया को एक साथ इकट्ठा करना थोड़ा तकलीफ हो जाता है। फार फ्लंग विलेजेस है, तो हमने प्लान किया कि ईच एंड एवरी विलेज को जाके उनका मुखिया का घर में जाके हम लोग डेली एक या एक दो दिन बाद हमारे टीम वहां जाके उन लोगों को सेंसिटाइज करेंगे और साथ साथ आसपास में जो जितने सब सेंटर्स है उन लोगों को स्टाफ का सेंसिटाइज कराएंगे और फार्मेसिस्ट को कराएंगे। कुछ फार्मेसीज है, बहुत ज्यादा नहीं, थोड़ी थोड़ी फार्मेसीज है। तो ज्यादातर रूरल एरियाज है यहाँ पे और विलेजेस थोड़ा दूर दूर में रहता है, थिन पॉपुलेशन है। तो हमने अभी तक 51 विलेजेस कवर किया है टिल डेट, विलेज मुखियास को, और 18 फार्मेसीज सेंसिटाइज किए और 8 सब सेंटर्स सेंसिटाइज किए हैं। और हमारा एक्सपीरियंस जो गांव वहाँ जो विलेज मुखियाज है उन लोगों से बहुत अच्छा रहा। हम लोग घर घर गए हैं, जाके उन लोगों को बढ़िया से बताए, सेंसिटाइज किए हैं। तो जितने मुखियाज है उन लोगों ने बोले कि हम लोग फुल सपोर्ट करेंगे। जब भी कुछ विलेज में मीटिंग्स होंगे, उन लोगों के लोकल मीटिंग्स होंगे, तो मीटिंग्स में हमारे जो ये सेंसिटाइजेशन के बाद प्राइवेट पब्लिक नोटिफिकेशन इंक्रीज करने के लिए और स्पुटम को ट्रांसपोर्ट कराने के लिए ये लोग मदद करेंगे। ये लोग बहुत बढ़िया से हमारे साथ बातचीत हुआ। तो लेकिन मई जून को बहुत ही बारिश था, फुल 2 महीना बारिश का चलते थोड़ा सा हमारा नोटिफिकेशन ये रेफरल कम हुआ है। और आशा करते हैं कि हम लोग आशास भी हमें ट्रेन कर लिए हैं, आशास जितने आशास है, मोस्ट आशास। और हमारा यहाँ पे जनवरी से अप्रैल तक एसीएफ भी चला, जो प्राइवेट पीरामल का, अभी ये टीयू में। और एक हमारे यहाँ 2 टीयू है, एक तेजू एंड लोहित डिस्ट्रिक्ट में एक टीयू है, अंजाव डिस्ट्रिक्ट में एक टीयू है, वो हाइलोंग का नाम से जाना जाता है, टीयू हायुलियांग। वहाँ पे भी एसीएफ चल रहा है। अप्रैल से चल रहा, शुरू हुआ है, अभी अगस्त तक चलेगा ये एसीएफ। तो लगभग एक्टिविटीज हमारे विलेजेस में हमारे टीम लगातार कर रहे हैं एक्टिविटीज। और हमने केसेस वगैरह मिल रहा है, लेकिन थोड़ा कम हो रहा है। आशा करता हूँ कि इस बीच से और हमारा जो केसेस रेफरेंस वगैरह आशास का थ्रो से, गांव बुराज जो विलेज मुखियास का थ्रो से, और भी हमारा रेफरेंस इंक्रीज होंगे। कोशिश हम लोग कर रहे हैं। और बाकी हमारे
थैंक यू डॉक्टर नाथ। अभी भी अपने पास हैं 15-20 दिन, और अब थोड़ा सा वर्षा कंट्रोल में आ गई है। तो मैं आपसे रिक्वेस्ट करूंगा, श्रुति गोयल, आपसे भी रिक्वेस्ट है, लगातार आप कनेक्ट बना के रखें डॉक्टर साहब के साथ। डॉक्टर साहब, बहुत अच्छी फीलिंग आएगी जब आपका डाटा बोलना शुरू करेगा और आपका पीडीएसए ऊपर बात करेगा। Dr. Manoj.
Absolutely. Let me absolutely. And Shubhangi, you can show the graph again, and I can talk to it. Go ahead, Commodore Raman. Yes, please.
Yeah. While Dr. Shubhangi puts her back, there was a reason I went from Delhi to Arunachal Pradesh. I think you do the thing, and then I'll come to my subject. Yeah.
Absolutely. So here we see several things. मैं 2-3 चीजें बताना चाहता हूँ जो डॉक्टर नाथ ने बोला, वो की लर्निंग लेसन है, अपने लिए अपन को शेयर करना है। एक तो आप क्लियरली देख सकते हैं कि जो प्रोसेस मेजर्स हैं वो शुरू हो गए। The process measures of sensitizing that will work towards getting more cases. But we did not see a reflection right away in the increase in the notification. और 2-3 reasons हो सकते हैं उसका। एक कि lots of times there is a delay. Sensitized लोग हो जाते हैं, पर there might be a delay in the notification. So that is one. Second, the weather and other external factors. We know that those external factors play a major role in patients coming and getting tested and so forth. Again, there is other activity that's being added on as ACF. I want to emphasize the following point. Doing the process of the process in the process measures, that is very critical. That is critically important. Jo outcome hai, that will come in time. You will find out how that outcome will change by tweaking your processes. So, Dr. Nath, don't be disheartened. This is a learning process, learning curve for you. You will be following and tracking those outcome measures and process. And if you find that sensitization alone is not working, wo kaam nahi kar raha hai sensitization, to aap dusri ideas, dusri cheez try karenge, and then that will happen. Now, there will come a time when notification will not go up anymore. Ek time aayega ki notification increase nahi hoga. और वो टाइम ऐसा टाइम होगा कि आपने मैक्सिमम ACF कर लिया है, आपने मैक्सिमम cases find कर लिए हैं, and now we're on the decline curve. So this is really important to keep in mind. The relationship between the process measures and outcome measures, and the relationship of the outcome measures to the overall epidemiology of tuberculosis in your district. This is a district level phenomena. I just want to make sure if there are any questions from our DTOs on this point, because now we are learning to see various sort of presentations of how the process and the outcome measures occur. So, Comrade Roman, I hope that was helpful. Not too much detail, but Dr. Nath, great job.
Absolutely. Great job. And thank you for bringing out the nitty-gritties, Dr. Manoj. You know, we started from district in Delhi, and then we went to Arunachal Pradesh, from the capital city to a distant northeastern state, okay, where we know the efforts are difficult to reach. And we have come back to Delhi with Dr. Charanjit Bakshi. DTOs, there is a very, very specific reason that I am doing this. And please listen to me carefully. And I would request you to kindly participate in this on the chat box while the PDSAs are going on. Kindly imagine if it was only left to us to make sure that we eliminate TB from your district. Okay, so there are structures in your district which are involved. There is a district magistrate who should play a part. There is your own NTP staff which should play the part. There are a group of NGOs which form a structure. There are medical colleges that form a structure. There are pharma stores and associations that form a structure. There are private doctors, and probably they have a union or they have an association, or they are under some establishment that form a structure. And there is NHM staff. I am sharing with you in the chat box this list. All I request you is please add to this list what are the structures which are existing in your district that need to be involved if we want to make your district TB free. Imagine that you have all the power. You are the god of your district. Who all would you like to touch and tell them, perform your job so that we can eliminate TB from your district? So please keep populating this list which I have made, and I will request Sadaf that if the list becomes spoiled, you copy that and you paste it properly to the list which I have made. And with this,
Yes,
I invite Dr. Charanjit Bakshi, DTO NDMC Delhi, to give her PDSA presentation.
Good evening. At the outset, I would love to thank you, and especially to the human library that I've been exposed to. Dr. Mukesh Raman, Air Commodore Raman Arora, and Dr. Salil, who happens to be my senior from the same alma mater. That was the main reason why I joined. The moment I heard it is endorsed, I was very keen to join this program. But I have learned a lot from you. And of course, I have not been able to bring in as many interventions and measures as I was exposed to. But you put me on a path where I know I can work and go ahead. My problem was low private notification. As Dr. Bindu had mentioned, that we are not able to tap the private people because earlier Jeet was there, so we were relying on them. Now that Jeet has parted ways with us, so it has become a double work for us. And it was something very new for me to be walking into this particular area. So my problem was low private notification, and the change that will be implemented by NDMC New Delhi district area, which happens to be a very large area. And we have 2 tuberculosis units, and we cater to a population of nearly 8 lakhs and a floating population of nearly 4 lakhs. So that is the problem where we have maximum, where the floating population is concerned. What we were trying to change was increase the private notification. And thanks to the beacons that I have been provided a tough taskmaster who keeps raising my bars every time. So from 17 to 37 private notified cases we'll be making. And by the last 2 weeks are left, so I have to make maximum changes here. And sensitization of PPs through regular follow-ups. My private notification from 17 to 37, by 16 to 31st July, using sensitization of PPs through regular follow-up by DTO and my team. And CMEs, unfortunately, had to take a back seat because of certain administrative issues. And sensitization of pharmacists and the private hospitals. So number of PPs, private practitioners who have been sensitized in person meetings have been not very many. And after sensitization, actually, we realized that they were very reluctant to notify. So I had to use a carrot and a stick approach with them. And earlier I have said, please do it. When they didn't, I would offer them the gazette notification that this notice will come your way. So then that notification would occur reluctantly. So in June, my intervention has started, and April to 39, April to June, we had about 42. In June, we jumped up to 65 due to the chemists started providing us with their annexures. Could you please, till today, I have started tapping our Connaught Place area chemists. So we've been able to reach a list from about 51, which was earlier only 23. The private patients notification also has come up a little, but I'll be working on this in this particular fortnight. So from private notification in June from 16th to 30th, we had done 14. From July 1st to 15th, we've been able to do 13. And my target, of course, remains that needs to be fulfilled. So
yes, Dr. Yeah, go ahead, Dr. Bakshi.
The number of PP sensitized through in meeting persons were approximately 4, and then CMEs, of course, I told you, and pharmacists sensitized have been about 6, and the number of patients details received from pharmacists has been, as I've mentioned, 51 this fortnight, and number of private patients notified have been 17, and after 27, I have to increase it further. My team had myself, my 2 STS, my STLS, and of course my DRTBHV, who's an immense help to me, Mr. S. Kumar, and my DEO, Mr. Pradeep, who have really helped me traverse these virtual lanes, which are very difficult for me at this age. So thank you. That's been my.
Great. Dr. Bakshi, thank you so much. And Dr. Salil Bhargav gives his regards. He's caught up in a meeting at the college. But warm regards from him from Indore. So several key points I want to make here, which are important for all of us to listen and learn about. One, you said that there was a problem which had occurred, a change that had occurred. And that I think many DTOs across the country, especially in UP as well, have faced, which is JEET, which was doing the public-private notification. They've sort of moved out. And then what happened was it left a big gap. And what you found was that hello, wake up to everyone else to say, listen, we can fill this gap. And you're using strategies with numbers to say how we can fill that gap. So overall, that is an excellent approach. And what I really want to impress upon is that this is real time. It isn't that you've waited for 3 months to realize that the private notification is going to be hit, but you've realized it in real time and you're taking real time action. So congratulations to Dr. Bakshi, very good.
One
Yes,
more
please.
point, sir.
Yeah.
I have to thank my two beacons, Sadaf and Dr. Tanvi, who have
Good.
really helped me out and have been very tough taskmasters as well. Thank you so much to both of them as well, sir. And
Yeah.
sir, Commodore Raman, sir, one thing I wanted to add to your list was religious organizations in my district. I have a Gurdwara, I have a Hanuman Mandir, I have a masjid, and I have a church in my area. So I would like to use them to push my notification, to bring in awareness of TB to
It
this.
will happen, Dr. Bakshi, for two reasons. One is because you just made the sankalp. And second, look at the coincidence that the next DTO who's going to present is going to talk about exactly this, what you have just spoken.
Okay.
So this is the beautiful
Thank you so much.
coincidence that has come in. So thank you, DTOs. You are adding to the list. And all I'm requesting again, we are not trying to see the individuals. I am looking at the structures that we must address. So please look at the chat box, look at the structures, I mean organizations that we must be able to touch so that they come in the support of the DTO, the district magistrate with his organization, all the medical colleges with their organization, all the NGOs, all the pharma companies. So please keep updating this list while I invite Dr. Swam Prakash Pandey, DTO Junagadh. And Dr. Pandey, with the Junagadh, we have a very great association. You know, Dr. Chandresh Vyas, and before that, another DTO who name is slipping from my mind right now. They have left a very big and a wonderful legacy. And I'm so happy to see the progress of your PDSA. So please, I will not waste any time. May I request Srishi to share the screen, and Dr. Pandey, please present your PDSA.
Thank you very much, sir, for giving me this opportunity. Namaskar, everyone present over here. Myself, Dr. Pandey Swam Prakash, working as a city TB official in Junagadh city in western Gujarat. The population of Junagadh city is about 3,84,000. The yearly notification as per Nikshay data is about 950. So we could work out that there is a need to improve the total notification. So we opted the best option, that is PDSA cycle, plan, do, study and act. So we defined our goal clear-cut, or more accurately, we defined our SMART goal as to increase the total notification by 5% within 2 months, that is in June and July 2022, by sensitizing the field workers like ASHA, the medical officials, and the private practitioners practicing in Junagadh city. So on 1st June 2022, we started our intervention with our team. The personal meeting was done with the medical officers of the various urban health centers. During the meeting, it was straightforward asked कि आपके यहाँ total number of आशा कितने available हैं एज ए फील्ड वर्कर, जिसका जवाब हमें 15 से 18 आशा अवेलेबल हैं इस रूप में मिला। तो my next question was कि अगर 15 से 18 आशा आपके यहाँ अवेलेबल हैं, तो फिर अगर पर आशा एक पेशेंट भी अगर रेफर किया जाए, या स्पुटम सैंपल पर आशा अगर एक स्पुटम सैंपल भी रेफर किया जाए डीएमसी के ऊपर, तो भी एटलीस्ट 15 स्पुटम सैंपल्स या 15 टीबी सस्पेक्ट रेफर होने चाहिए। इसके अगेंस्ट में उन लोगों के यहाँ का जो रेफरल रेट था वो 2 या 3 का था। तो इस पर उनको सेंसिटाइज किया गया, उन लोगों ने एक्सेप्ट किया, और as a result of which there was actually a drastic change in the referral rate of TB suspects as well as the sputum samples referred by ASHA. Actually, it was earlier in 1 or 2 digits, which drastically changed to 3 digits. So it was very encouraging for us to see the outcome. And in the meantime, a letter was issued to all the medical officials of the urban health centers with clear-cut instruction that each and every medical officer should refer at least 5 to 10% of the new adult OPD cases, as well as they were instructed to sensitize the ASHA of their urban health center in such a way that at least 5 samples are collected per ASHA, and they followed these instructions wholeheartedly, as a result of which we could get the result or outcome with a drastic change in the data. So this intervention has worked. In addition to this intervention, we have also explored some other opportunities for spreading the TB awareness by contacting the spiritual leaders of Swaminarayan Temple located in Junagadh city, and they have cooperated like anything. They themselves took the responsibility to announce before the public about the awareness of the tuberculosis and how should they behave, or how should they be aware of this disease. And they did a lot for our team. So we are thankful to the spiritual leaders of the Swaminarayan Temple, which might have resulted in increase in our TB notification. So as a whole, by analyzing our data, we have come to the conclusion that we should continue or move forward with our intervention. And in addition, we have also decided to sensitize the private practitioners, particularly the BAMS and BHMS doctors who are practicing in Junagadh city. And in the meantime, I would like to thank my learned counselor as well as the experts who are guiding me in this endeavor wholeheartedly. And in the last, I would like to thank each and every one present over here for patient hearing. Thanks a lot.
What wonderful work, Dr. Pandey. Superb. You come from a district that has done fabulous work. There's several areas I want to point to, and if Shasti, if you could, yes. So I want to first look at this graph of number of patients referred by ASHA, and I want to make a very, very clear point to our team here, to our DTOs. And it is the following. Action leads to impact. You can see very clearly a set of actions that were taken. Bina aapki action se 16 se 275 nahi hota. It is action which leads to impact. Now, even at a process measure level, how it translates to the outcome measure, we will have that's a different conversation. But what we are seeing here is that in a real-time manner, DTOs are saying, if I take this action, what will happen? And this is what you need to take this data to your collector and say, I need those ASHA workers to be engaged and sensitized. And then they will say, okay, what have you done? And this is what you show them. You said you have decided to take action, and you were able to sensitize them and increase the referral. And then with time, you can show them what and how it has impacted your outcome notification. So I think that's really important. Second, you have gone out of the box and taken groups like Swami Narayan Temple and others that you know have a great pull in the community. And you're setting an example for other DTOs, as we've heard about Dr. Bakshi and others, and are also going to be able to learn from your experience. So get on the phone with each other, communicate on what worked for one community and didn't work for the other community. Cross-learning, excellent, excellent work, Dr. Pandey.
Thanks a lot, sir.
Thank you, Dr. Jain. And absolutely, we have had examples of a letter from the district magistrate, letter to the pharmacists, H1 schedule notification, a bit of warning, some kind of strict letters, all kinds of letters with languages are available. We are showcasing it here so that if you wish to do it, we can share it with you. You can just translate it to the language and utilize it as much. Now, Dr. Jain, it is not that, once you start doing the PDSA, everything falls into place and, the notification just starts improving. What PDSA does, and of course, I'm just talking to you essentially to make a point to the other DTOs, it tells you where the problem is, where is the focus right now. So all kind of PDSAs you will get to see, and we are not trying to influence anybody. It is not our objective to only show that, PDSA started, notification is improving. No, if we can show you where is the problem, why is the notification not increasing, where we need to focus, I think that is a bigger battle one than, simply no notification increase taking place. I now invite Dr. Santosh Solanki, DTO Alirajpur, Madhya Pradesh, to present his PDSA. Ekta, may I request you to kindly start sharing your screen? And incidentally, both the counselor and the team lead for Dr. Santosh are Ekta. Please, Dr. Santosh, go ahead.
Good evening to everyone. I am Dr. Santosh Solanki from district Alirajpur, MP. The problem in our district is low public notification, and our aim is we will increase public notification by 10% from current scenario, which is 176 to 192. Within 2 months, using the sensitization and training of MOs, sensitization of ASHAs to increase presumptive reference. And our team will measure our improvement by implementing the process measures, which are number of ASHA sensitized, number of MO sensitized, and number of presumptive patient referral by MOs and ASHA. And outcome measures will be the public patient referred by MO and ASHA. We having the team total 5 members selected, including me, and we have selected 2 BMOs, 2 STS and STLS, headquarter STS, STLS, to implement the process measures and measures outcome. Sir, initially we are regularly conducting the training sessions and ASHA sensitizations but the outcome was very poor. इस ग्राफ में हम देख सकते हैं, हम रेगुलरली मार्च से सेंसिटाइजेशन ट्रेनिंग्स आशाओं का रेगुलरली कर रहे थे, बट द प्रोग्रेस जो आउटकम था वो काफी पुअर था. इसमें सर मैं ये थोड़ा सा बताना चाहूंगा कि इनिशियली जब मैंने बूस्टिंग टीबी नोटिफिकेशन के कुछ सेशंस अटेंड किए, इनिशियली 2-3 सेशन जो कैपेसिटी बिल्डिंग और उसके सेशंस थे, उसके बाद हमने ट्रेनिंग डेज और इंटरवेंशन डेज के दौरान उन बिंदुओं के थ्रू हमने ट्रेनिंग से स्टार्ट की, बैच वाइज, ब्लॉक वाइज. तो यहाँ पर थोड़ा सा इम्प्रूवमेंट हमें नजर आया, पेशेंट्स रेफरल में भी इम्प्रूवमेंट नजर आया है, पेशेंट नोटिफिकेशन में भी इम्प्रूवमेंट नजर आया है. और वी आर स्टिल कंडक्टिंग ट्रेनिंग्स इन रेगुलर बैचेस एट ब्लॉक लेवल, एंड स्टिल वी आर वेरी कुछ नंबर्स हमें ट्रेनिंग करना है एमओस की, जो हम रेगुलरली कंप्लीट कर लेंगे सर. एमओस को हमने टोटल 12 नंबर सेंसिटाइज कर दिया है. Still we have pending 38 MOs and our baseline target अचीव हुआ था, 150 अचीव हुआ था सर. करंट सीन में हम 176 अचीव किया है. एंड फाइनली एट द लास्ट ऑफ PDSA साइकिल वी डेफिनेटली वी हैव अचीव 192. We have adapted the cycle and still we are continuing the program, and initially we have started in 3 blocks sir. Now we have started in July, all 6 blocks we have started the plan sir. So definitely we will achieve the target.
बहुत बढ़िया बहुत बढ़िया.
ये सर कुछ ट्रेनिंग रिव्यूज है सर, हमने कुछ भाषाओं के सेंसिटाइजेशन, इस पे हमने इवन STS STLS से ही ट्रेनिंग सेशंस ऑर्गेनाइज कराए थे. जहां भी कुछ डिफिकल्टीज आती है वहां पर DTOs और मेडिकल ऑफिसर्स इंटरवेंशन लेते हैं सर. कोई भी आशास को दिक्कत आती है कुछ समझने में, यहाँ पे सर मैं ये कहना चाहूंगा कि आपने PDSA ट्रेनिंग से जो कुछ बिंदुज लिए हैं वही बिंदुज हम यहाँ पर, जैसे कैपेसिटी बिल्डिंग्स का जो सेशन था सर, वही बिंदु हम यहाँ आशाओं के साथ डील करते हैं. तो वो बिंदुओं से यहाँ थोड़ा सा हमें काफी कुछ इम्प्रूवमेंट देखने को मिला है सर.
Excellent work. So Dr. Solanki, several questions आपने बहुत अच्छा दिखाया, और 2-3 चीजें आपने बोली जो मुझे काफी अफेक्ट करी in making me think more. एक आपने बोला कि आपने रियलाइज करा कि आपके जो इंटरवेंशन प्रोसेस मेजर्स थे वो ठीक काम नहीं कर रहे थे, तो आपको ट्रेनिंग चेंज करनी पड़ी. क्या वो आपने एक्टिवली कैसे मालूम पड़ा कि वो इंटरवेंशंस इम्पैक्ट नहीं हो रहे थे? हाउ डिड यू रियलाइज?
सर प्रीवियस डाटा को असेस किया सर, टीम के साथ बैठ के, वहां से ये डाटा रियलाइज किया कि ट्रेनिंग्स तो हम रेगुलरली कर रहे हैं सर, लेकिन जो आउटकम आना चाहिए वो सफिशिएंट या वो नहीं है, सेटिस्फैक्टरी नहीं है सर आउटकम.
राइट. So one point I want to make to all the DTOs is data is not for reporting. Data is for decision making. So clearly very, very important. Do not use the data for just reporting. मतलब आप इतनी अच्छी चीज, पकी हुई चीज फेंक रहे हो, right? इतना अच्छा आप सोचो, आपने घर पे बहुत अच्छा खाना बनाया है और आप वो खाना बस दिखाने के लिए नहीं जा रहे हो, पर वो आप खा रहे भी नहीं हो. You're not using it for your benefit. So the data is that thing that you have worked so hard to work and gather. Don't throw it away. Use it. Have a meal with it, and then be satisfied in the next action. एक चीज. मैं दूसरी चीज बोलूँगा कि if you can, एकता, you can put the graph again of the team. मुझे आपसे ये पूछना है डॉक्टर सोलंकी, आप टीम मेंबर्स बताइए, आपकी आशा वर्कर्स में कोई ऐसी एक आशा वर्कर है जो rather motivated है, वो energized है और वो engaged है आपके साथ? एक आध कोई होगी आपकी जानकारी में? आप म्यूट पर हैं.
हेलो.
हाँ जी. Is there some ASHA worker who is engaged with you, who is active और बहुत अच्छा perform कर रही है?
Sir, we have selected at least 10 to 15 ASHA workers हैं sir, जो
Excellent.
लगभग मंथली मतलब पर ईयर अराउंड 15 to 20,000 एज ए ट्रीटमेंट सपोर्ट और इंसेंटिव्स लेती हैं सर, और वो रेफरेंस भी काफी करती हैं।
पर ठीक है, बस मैं एक के लिए पूछ रहा हूँ, ठीक है, एक तो है, कम से कम 10-12 है, दैट इज ग्रेट, ओके, यू हैव वन। क्या does that ASHA worker have a mobile phone, yeah, some phone that they can connect with you?
Yes sir.
Excellent. मेरी ये थॉट है, और मैं डीटीओ से भी ये पूछूंगा, आप सोचिए आपकी टीम मेंबर्स में एक डीटीओ है, आपकी टीम मेंबर में एसटीएस है, एसटीएलएस है, अगर आपकी टीम मेंबर में आप एक अच्छी सी जो आशा वर्कर है, अगर आप उसको भी आप ऐड करें, तो दूसरी आशा वर्कर्स देखेगी कि क्या हुआ, वो आपकी टीम को जो रिस्पेक्ट होता है वो चेंज हो जाएगा। They will begin to respect your team as a team which is not just seniors but themselves. So the point of PDSA is to bring a level of equality amongst all, that we have knowledge. It is not just that the DTO has the knowledge. It is not just that the STLS has knowledge. We bring them to that same pedestal to say, ASHA workers, you are part of the team, and you just need to bring one ASHA worker, and all will have the mentality and thinking that I am part of that team, because they can relate to that ASHA worker. What do you think, Dr. Solanki? Is that something that could happen?
Sir, definitely.
Okay. So this is what my experience has found when we have worked in different settings, even in America. We were trying to change something in the surgical suite, even the simple proper cleaning of a surgical suite, because we were having many infections. तो हमने जो janitorial staff है, उनको भी हमारी meetings में बुलाया with the CEO of the hospital. Just think, CEO sitting in the one janitorial person was sitting. The janitorial person had contact with 30 others, and as soon as every one of them heard that he was in the meeting, everything changed. Everything changed. So I share that example with you. It's a real life example, and I promise you, this is human psychology, that ASHA workers will feel so grateful and respected if they are brought into a team with, elites, with DTOs, with others as well. Great work, Dr. Solanki.
Thank you, Dr. Manoj and Dr. Santosh. मेरा आपको पर्सनल लेवल पे बहुत थैंक यू है। मैंने आपका जब PDSA स्टडी किया तो मुझे इससे इतना फायदा रहा कि इतने सारे पॉइंट्स हम बाकी DTOs के साथ शेयर कर सकते हैं, और मुझे इतना अच्छा लगा कितने फक्र से आपने कहा कि मेरे एफर्ट्स डाल रहा हूं बट मुझे आउटकम नजर नहीं आ रहा है. This acknowledgement that you have done, Dr. Solanki, today, I am certain your district is going to be on a huge improvement path, because as I said, Dr. Manoj, the PDSA, and you rightly, exactly picked up my mind when you said it helps you in decision making. It is not aiming for notification increase. Notification बढ़ जाएगा, but आपका decision making, आपने खुद देखा कि मैं efforts डाल रहा हूं, शायद efforts पर्याप्त नहीं हैं, मैं sensitize कर रहा हूं, शायद मुझे थोड़ा और sensitize करना पड़ेगा, क्या मेरा direction गलत तो नहीं, क्या मेरा approach different तो नहीं अपनानी मुझे. आपके सामने सब चीज व्यक्तिगत रूप से PDSA आपको दिखा रहा है. So thank you, Dr. Santosh, thank you so much. और जितना प्यारा तरीके से आपने अपने PDSA को explain किया है, I am really thankful to you for actually bringing out the problem which you are facing. Everybody is facing problem. Thank you. With this, I invite Dr. Mukul Tiwari to now show how interventions can actually show progress. Sadaf, thank you so much for starting to share your screen. Dr. Tiwari, please make your point. Dr. Tiwari, are you there?
Yes, Dr.
Yes.
Mukul.
Yes, I can see you.
Okay, sir. Good evening, everyone. I am Dr. Mukul Tiwari, DTO Umaria, MP. This is my problem, low public notification due to the lack of referral by ASA, CHOs and MOs and lack of HR. Then aim statement is in Umaria, we will increase public notification by 15%, 192 to 221 notified cases within 16/6/22 to 31/7/22 using conducting camps, sensitization of ASAs, CHOs, sensitization of MOs regarding the referrals, involvement of DPM, BPM and BCM.
Sadaf, please zoom more.
Yes, sir. And these are the measures. Number of camp conducted in and number of suspected is identified through the camp, number of ASA sensitized and number of cases referred by ASAs, number of CHO sensitized, number of cases referred by CHOs. And my team is DTO, DPC, DTO myself, DPC Simmi Wankhede, STS Sandeep Gautam, STLS Nipen Singh, DO Kapil Korel. Outcome measure, number of public patient notified. Then this is the process outflow. Treatment, home visit by CHOs, presumptive TB patient referred to DMC from HWC. Number of ASAs referred, number of referral by ASAs worker refer symptomatic patient to OPD, then patient visit OPD with symptoms, physical examination done for screening, sputum sample collection, treatment initiated notified on its check, sputum smeared microscopy by knot, then we do chest x-ray and true CB knot, true knot CB knot. Then this is the graph we have to show. We can see then March, April, May, June. There is number of camp conducted. There is red line, which is the number of suspected cases identified, and there is a blue line, number of camps conducted. And in the second graph, this is the chart. This is the graph, number of ASA sensitized 0 and number of cases referred by ASA. There is in April, May, June, and this is the third graph. In third graph, in March, number of CHO sensitized from March to May. This is the graph, and in the June referred is 0, and outcome measures there is increase in the notification. In April there is 53, and in June there is a in 16 to 30 June there is a 60% notified. We can see that after attended training of TB notification, we can increase the number of notified cases from 16 to 30 as
Dr. Tiwari, did we get muted? Yes, go ahead.
Network problems. Dr. Mukul, you're on mute.
डॉक्टर मुकुल आप म्यूट हो गए गलती से, आप प्लीज अपने आप, हाँ, यस, अनम्यूट कीजिए. Edwin, it is because of us. Kindly see.
No, he has to unmute from his side. I have unmuted full.
Okay. Dr. Mukul, we cannot hear you. Please unmute. गलती से म्यूट हो गया है.
Okay, so maybe Sadaf, you can complete the PDSA and then I'll make my comments.
Yes, sir. Sir, the target was from the notification that, as we can see, we had set a target from 192 to 221. And if we see the results over here, till this date, 200 cases have been notified and we are very close to the target. Although there few interventions have started, but few interventions are still yet to start, but still they are making an effect, and we can already see it in the notification.
Great. So when later time we can get Dr. Tiwari in, there are a set of questions I wanted to ask. What is quite remarkable is to see his increase in the notification. If you show that graph, Sadaf, to go up on the graph of notification and the outcome measure. So here what we see is, again, the outcome measure has gone up incredibly high. And the process measures have, yes, increased, but not dramatically. So what, in this case, what does one do and what does one think? It is the following. It is required thoughtfulness on the ground that we have to ask, was there a particular reason why this happened? Maybe an outside reason that could have been. There may be another agency that was working towards increasing notification, possibly. If not, then amongst the process measures that are there, was there one particular process measure? क्या कोई process measure था जिससे बहुत impact make हुआ? So for DTOs, here's a learning lesson. Yes, you are trying 4 or 5 process measures, but soon enough, when you begin to ingrain this PDSA cycle in your work, you will be seeing what process measures may have had the most impact, and then to utilize them and prioritize them. That is very, very important concept, that here you are able to see the different process measures at work, but soon you will zoom in on into what process measure works the best. So that is a great example of the relationship between process and outcome, and then multiple processes and what process works the best. So great work, Dr. Tiwari. I'm sorry that you're unable to unmute at the moment.
Dr. Manoj, Sadaf, let the screen be on.
Yes, sir.
Dr. Manoj, I will give a very, very different analogy, absolutely to what you said. You know, the process measures planned were number of camps to be conducted. Then they said we will sensitize the ASHA also, and the CHOs were to be sensitized. The best part is they have been able to do the camps, focus there, do the sensitization of the ASHA, and that is what is showing the increase in the notification. The CHO sensitization is still pending. Imagine if that also happens, we've already reached 200, 221 is the target. What wonderful difference it will make to this district's performance and data and to the TV notification. Sadaf, you were wanting to say something?
Yes, so that's what I wanted to say, that just because of these 2 process measures, we can see that the presumptive cases had been identified more in the camps. And also, though there has been no sensitization of the ASHAs, but he mentioned that like there has been no single meeting, but when the STS and the NTP staffs keep on meeting the ASHAs one-on-one whenever they come for sample visits, and one-on-one sensitization keeps on taking place. So that's why the number over here has been showing 0, but still in the background the sensitization has been happening, and thus this referral has increased.
Absolutely. So what a wonderful analogy has come up. The process measure has not been implemented. We need to see which process measure is making the difference, as Dr. Manoj highlighted. And still, one process measure is pending to be implemented. What would be the wonderful impact of that to be seen? Thank you, Sadaf. Thank you so much, Dr. Mukul. With this, I invite Dr. Sudha, DTO Chitradurga, Karnataka, to present her PDSA. And Dr. Sudha, very soon we will be coming to your state in a different avatar and doing a longer course with you for 6 months. We will be coming to Karnataka, Kerala, Andhra Pradesh, Telangana, Andamans, Lakshadweep, Tamil Nadu, and we will now get into actual details of the beauty of the PDSA. So far, we are just learning how to increase the TV notification. So yes, may I request Dr. Sudha, please present your PDSA.
Dr. Sudha, you have to unmute yourself, please.
Till then, Ekta, you may have to do it.
Keep presenting, Abhishek. Keep sorry.
Yeah, Ekta, go ahead, present, and then Edwin,
Abhishek,
we may have to.
There's a problem.
Edwin, we may have to look at the technology if everyone is able to unmute or not. Go ahead, Ekta, go ahead, present until we can.
Yeah, we're doing it. The standby has taken over, Dr. Manoj.
Okay.
Yes, so this PDSA was of Chitradurga, Dr. Sudha, and the main problem was a low total notification due to low referral from MOs and some private practitioners. So ma'am have decided to work on both. Mainly, she has decided to two TB unit, Holarkare and Hosadurga, and to increase total notification by 10%, that is 69 to 76 notification in 2 months. So mainly what ma'am has decided that she will sensitize MO and especially the taluka's doctor and do the follow-up with them, and also sensitizing private doctors through PPM coordinator. So this was the main target and aim statement that ma'am has formed. So the team which ma'am has decided, yes. So DTO ma'am, DPC, Chitradurga, Mr. Prithviraj, PPM coordinator Chitradurga, Mr. Nandan, STS Hosaldurga, and Hosadurga, Mr. Ramesh. So the ma'am started interventions, and the main process measures was number of MOs and taluka doctor sensitized, number of follow-up done with them, the MOs and the taluka doctors, and PPs sensitized by PPM coordinator. Can you go in run chart, please? Abhishek, can you go down? Down, please. So the intervention has been started from 1st June in both TB unit, and the total number of MOs and taluka doctor which was targeted was 38. Out of them, 31 was sensitized, and repeated follow-up was also done, which has been done by ma'am. But there was still some tendency in sensitization of PPs by PPM coordinator. The targets was 40, but ma'am has sensitized 29 private doctors by the team. So accordingly, the baseline was, if we say the March and April, it was 69, and ma'am has targeted to achieve up to 76. Still, it is working, and ma'am is tracking the data.
Great. Excellent. Dr. Sudha, if you're on, apologies for not being able to get you to tell us about your interventions. And we can see clearly that your process measures are making a huge difference in improving those processes and your focus on there. And then we wait to see the notification numbers follow up. Great, Commodore Raman, we can go to our next PDSA.
Thank you so much, Dr. Jain. And definitely the time kaise guzarta hai, you know, how the time passes with these wonderful people, one doesn't realize. So I invite Dr. Manoj Kumar, DTO Sitamarhi, Bihar. Bhumika, if I may request you to start presenting. Abhishek, if you can show the, okay, go ahead.
Hello, sir.
Namaskar, Dr. Saab.
Namaskar. Myself, Dr. Manoj Kumar from Sitamarhi, DTO from Sitamarhi district, Bihar, which is located in the northern part of Bihar at 140 kilometers from state capital Patna, and having 42 lakh population, and annual notification is about 3,200 per year. The main problem in our district is less number of notifications. Annual target was 5,400, but we were reporting 3,200, 300 in this way. So, and now the target has been increased to 6,100. So I thought how to improve this notification. First of all, the main thing is awareness, mass awareness of the people. Until and unless we create, demand is created, generated in the public, we can't do anything. So the main thing is health seeking behavior of the people and lack of knowledge. So I can't approach all the people. So I tried my those NGOs, ASAs, ANMs, and medical officers. I tried to sensitize all of them. And Jivika, my main focus was Jivika disease. The number is 4 lakhs in this district, Jivika disease. So whenever there is a cluster level foundation workers meeting in particular block, I tagged my tour program accordingly. And I went to the cluster level foundation meetings and I did sensitization of those Jivika disease. In ASA Divas meeting, I do the ASA sensitization and as well as ANM sensitization. So in this way, I did this process measure. My main aim was to achieve notification, improve notification by 2% and by 5% in 2 months. So by these process measures, I improved my total notification. In my team, I was myself, Dr. Manoj Kumar, data entry operator Ranjan Saran, DPC data program, district program coordinator Ranjay Kumar, and STLS headquarter Sanjeet Kumar. So with this team in DTC, we have chalked out our program of mass sensitization. And you can see the data. The data low, a bit low, madam. Intervention, I started intervention in the month of June, and you can see the baseline again lower. In 1.5 months, the notification was 574 from 15th March to 30th April. But you can see when I started from May to June, it has gone up to 675. 5% improvement. We should achieve 602, but we have achieved not only 5%, but 15% improvement in notification. And I hope by mass awareness, we can improve by demand creation, we can improve this. In spite of all hurdles of lack of infrastructure, scarcity of HR, 50% HR, interrupted supply of logistics like lab materials and drugs, and especially no ownership of general health delivery system. They are still not taking it as NTP as its parts and parcel. They are thinking that it is the duty of DTO, DTC. They have to take care of all patients of this district. But I am trying my best to sensitize them to do this work of NTP also. And by utilizing this PDSA, I hope it will guide me in a systematic way, in a positive way, in a calculated way to achieve my target. Thank you.
Excellent. Excellent, Dr. Kumar. And there are 2 parts to this that I want to highlight. You are working on that demand part, which I will say is a huge challenge because there's a huge population that you have to cater to. But with it, you're also targeting and sensitizing medical personnel to then meet that demand. And so you're putting all of those together. And I completely understand the logistics and other challenges that you have. So great work. And yes,
I have also sensitized private practitioners as well as village practitioners too. Their number is very large, village practitioners. And in groups, I have also sensitized them village practitioners also.
Great. Okay, super work, Commodore Raman, and we can have our next PDSA.
Thank you, Dr. Manoj. So, Dr. Manoj, we saw that the plan was 5% increase. Dr. Manoj Kumar went up to 15%. We have Dr. Modi with us. I don't have to introduce Dr. Modi to my staff, anybody else, but Dr. Modi and our association goes long back, and we have been together now working. We have been receiving a lot of guidance from Dr. Modi every now and then. It has been 2 years. And Dr. Modi, may I request you to please present your PDSA. And once again, let us see how the targets have been surpassed. Dr. Modi, बहुत स्वागत है आपका.
Sir, thank you, sir, for your kind words. Myself, Dr. C.S. Modi, from Bikaner, Rajasthan. This is the border district, international border district of India. And it is around 28,000 square kilometer district. The problem is the low private notification. Our aim statement is to increase the private notification was from the 5%. It was around 185 notification, 244 notification. We have to make a target to increase in the 256. We make small target for the 2 months and make target for bigger after the 2 months and more bigger in the next months. The process measure is the number of the PPs sensitized to notify on time, number of active PPs motivated and follow up, and number of patients notified in the private sector. Screen में थोड़ा दिक्कत आ रही है. हाँ, my team is myself, Dr. Modi, CS Modi, and my DPC, Mr. Bhargav, and my PPM coordinator, Mr. Rajawat. What is the next? This is the process measure, sir. इसमें मैं आपको समझाता हूँ कि मतलब हमने PPs को पहले आइडेंटिफाई किया. पहले लिस्ट आउट द ऑल PPs in the Bikaner. The more list out the every PP who is seeing the patient at their home or at their hospital. We list out all PPs, then find out the how much PPs we can utilize in our program, because not every PP is doing the medicine practice or some other practice. Then we think that 139 PPs will be available for us to utilize in our program, and this we have to start the sensitization of the PPs. And started from the 39, we have sensitized more than 81 PPs in the step by step. Number of the private PPs we in the every month we have started from the 29 and 80 to 83 and 85, and then the process is going on. Number of the patient is actually increasing. See the baseline number of the active PP is increasing. पहले अपने को PPs को एक्टिव करना पड़ेगा, PPs की एक्टिविटी को देखना पड़ेगा और वो अपने को कितना मतलब दे सकते हैं. उसके बाद में जस्ट आप देखिए जो 185 का टारगेट था उसको 244 हुआ, एंड नाउ वी रीच दैट 256. और मैं सोचता हूँ कि इट इज नॉट 256, वी विल रीच मोर देन 400, समथिंग मोर देन दिस. And this is the very valuable for the program, because these patients not coming in the public sector, never public sector. But this is the plan of our increase the private notification. DTO, PPM go to the field, and when will the test be done? July, 1st July to 1st June to 31st July. And we made a Google Sheet and collected the data. Now we are analyzing the data and become weekly. Every week we are analyzing the 9 indicators in both private and public also. I shared some sheets to our TI and our QIC that this is sheet of our, I am analyzing these data every week. DBT and private notification and HIV and diabetes, even presumptive examination also we are analyzing every week. So this will very increasing results in our notification, that we have to reach more than 70-80% notification this time. This time we have reached to 70-80% notification. We think that we will, if we add the private notification in Bikaner district, we reach more than 120% of the target. I think this is our threat. What is the
So great. Yeah, go ahead.
Yes.
So great work, Dr. Modi. Yes, yes. Excellent work. Yeah.
सर इसमें अपने को बहुत छोटा छोटा प्रोसेस लेना पड़ेगा. हमें जरूरी नहीं है कि एक साथ 20, 25, 50 को सेंसिटाइज करें. 5, 10 को सेंसिटाइज करेंगे. पहले उन लोगों को सेंसिटाइज करें जो हमारे विश्वास में है, हमारे कॉन्फिडेंस में है. और सारे मेजर्स काम में लेने पड़ेंगे. उनको आपको गजट नोटिफिकेशन भी दिखाना पड़ेगा. उनको केमिस्ट के डेटा भी दिखाने पड़ेंगे. उनको केमिस्ट का डेटा दिखाएगा सर आपके वहां से इतने लोगों की दवाई निकली है, आपके वहां से इतनी मेडिसिन सेल हुई, प्लीज आप हमें कोऑपरेट कीजिए. तो ये एक हमारा थोड़ा सा इंटरवेंशन रहा. आई थिंक इट विल इंक्रीज मोर देन 20 or more than 50% of the time.
Oh, beautiful. What you're saying is you're using the data now to convince them, the people on the ground. And अपन सोचते थे कि डेटा का इम्पैक्ट कुछ ज्यादा होगा नहीं, अपन बस रिपोर्ट ही करना है. बट अगर आप उनको डेटा दिखा रहे हैं, that is superb work. And several things you've said, I'm quickly going to remark on. One, you said that you're working on all 9 measures in a similar data-driven manner. And that is the way to achieve TB free. If you're going to get...
और अगर अपन ने उनको एक बार पोस्ट कर दिया ना डेटा, रजिस्टर्ड पोस्ट, मैं कभी-कभी ऐसा भी करता हूँ कि जिस लैब से डेटा नहीं आता है, जिस मेडिकल डेटा है उसको रजिस्टर्ड पोस्ट कर दिया, तो आपके पास दूसरे दिन ही सारे डेटा लेके आता है कि सर आप प्लीज जैसे मत.
Exactly. These are little tricks.
अपने को काम में लेना पड़ेगा सर ये मेजर्स को. एक्चुअल में गजट नोटिफिकेशन इज सीइंग एवरीथिंग. एवरीथिंग इन गजट नोटिफिकेशन. केमिस्ट आप नोटिफाई कर सकता है, लैब नोटिफाई कर सकती है, इवन पेशेंट हिमसेल्फ नोटिफाई, पेशेंट खुद नोटिफाई कर सकता है.
Perfect. Great work. Great work. And over to you, Commodore.
Thank you, Dr. Modi. And DTOs, I would like to also say that Dr. Modi is very, very active, very, very senior DTO. And, you know, he's our faculty also. He has had the benefit, and we have also had the benefit of his experience, and he's had the benefit of doing the full PDSA course. So why I am making this statement again and again is because we will be now moving to the southern states, and all of you will get the opportunity to do the entire course with us for 6 months. And so thank you, Dr. Modi. And DTOs, the clock is showing 6 o'clock in the evening. We had taken approval only for 1.5 hours of your time. We are guilty that, you know, there are a lot of DTOs ready to present, but the time is important. So we will start with your presentation next. Counselors, my personal apologies to you. Team leads, you can split my hair and you can do whatever you want in the first 15 minutes tomorrow morning when we have the briefing. I want to tell you, DTOs, that I may appear like a tiger on the screen, but these counselors and these team leads, they put me in the leash. और मैं उतना ही कर पाता हूँ जितना ये लोग मुझे allow करते हैं. So we will have your presentations because the discussions were so interesting. They were so interesting, and the analysis that we were having was so wonderful. These sessions are much more than we can have, you know, the council interaction or the weekly interaction with you. So many, many thanks, Dr. Manoj Jain, for bringing out these, you know, these micro things of the analysis. I am certain there are many DTOs who are listening to the presentations would have realized कि ये हम भी कर सकते हैं. We can also do it. I can also try this technique. This is our objective. This is our only objective, to make sure that this technique, this approach, this knowledge sharing, it spreads like an infection, like a very, very positive infection in the entire country. So with this, Dr. Manoj, if you have any last minute comments to make, otherwise.
Yes, absolutely. And then thinking about it as an infection, look, one PDSA, and then our DTO, Dr. Modi, is doing 9 different data analyses and getting ready to think about 9 different PDSAs. Likewise, let us also continue not just in this 3 months, but then see how in the following months to come, you begin to hardwire this in your work. So great work, all the DTOs, so many good presentations. These presentations are going to be available to you. Share them with your other DTOs, share them with your STOs, share them with your family. They will love to hear your voice and your presentation on an international forum. And certainly the southern states, you will be hearing from us, and we would love to join you for the six-month more in-depth conversation. So Commodore Raman, great work. Thank you so much to you and to our QICs, our counselors, as well as our team leads. Amazing. I know that so much work goes on in the background. अपन 5 मिनट का presentation होता है, पर 5 घंटे या 50 घंटे का काम has been put into it. So wonderful, wonderful work.
Thank you, Dr. Jain. Thank you so much. And obviously, even my gratitude to the counselors. Don't leave the good work. You have to only increase in the next 15 days. Please make sure that the DTOs never find you wanting. You're always there with them. Team leads, please guide your counselors. We are doing great thing. 15 days more to go. And let's make sure that, every district is talking about this program. And these clips, as Dr. Manoj said, we will make sure it is available to you, DTOs. Please show it to the world. You have made presentations, you have made progress, you have showcased the effectiveness of the tool. It is your data, it is real data, it is authentic data. So thank you so much. And with this, my thanks to CTD, thanks to Emory Global Health Institute, thanks to WHO, thanks to Indian Institute of Public Health, Gandhinagar, all wonderful counselors, your team leads, and to all the staff and the IT team of CTI. Thank you so much.
Thank you, everyone. Namaste.